All right, so now it's time to DC and IV. What are we going to do? We're going to check the doctor's order. We're going to come in and verify the patient with the wristband and ask them their name. Then we are going to ensure adequate lighting, patient privacy, ensure that I've washed my hands. And since I'm Indiana, I can actually say washed my hands, and it's acceptable. And now we're ready to go. Get the bed to a proper working height. Those are the things you gotta say for every patient, every checkoff. Don't forget it. Now it's time to get started. I've put on some clean gloves. I've got a sterile little gauze pad within reach. I've got a little Band-Aid. I'm going to just go ahead and open this up and have it ready. Now the hardest part I always tell people is taking the tape off. So we're going to start ripping our tape off. People always talk about how tough it is working with gloves, and I'm like, well, it's just going to have to be tough because I'm damn wearing my gloves for safety. You'd be surprised how many people out there have hepatitis and whatnot and don't even know it. Now, I can't say I'm really crazy about liver, but I'm just crazy about my liver. Okay, now we're getting down to the actual IV area stuff. And sometimes it can be kind of tender with this stuff going in, and because a lot of times the like if they're on big gun antibiotics, that stuff can kind of hurt. Potassium is notorious for being painful infusing into a patient. And I'm just kind of working my way all around, getting down close to the insertion site. I'm just taking my time. I'm not in a hurry. This is not an emergency. Okay, so we are ready. I'll tell the patient, okay, we're going to pull it out on 3. I got my gauze ready to put pressure as soon as I pull it out. 1, 2, 3. And a lot of people will say they didn't even feel it. And I'm like, well, good. Good for you. And I like to hold pressure for a couple minutes. Then after that, you take the gauze off if it stopped bleeding, put your Band-Aid on. All done.